Hi, I'm Dr. Malpani and I'm an IVF specialist. I'm going to talk to you about the hormonal medications which we use to regulate the menstrual cycle. Now, most women will have a regular menstrual cycle, so that just makes life a lot easier. What does a regular menstrual cycle mean? It means that you ovulate or that you produce an egg on a regular basis. What happens if you don't produce an egg on a regular basis? The medical word for this is called not ovulating or anovulation. And when you're not ovulating, obviously if you don't produce an egg, the ovary will not produce the right levels of estrogen and progesterone, as a result of which the endometrium lining will not shed correctly. This will cause problems with menstrual periods, which means either the menstrual period will come early or the menstrual period may come late. The reason for the anovulation will only be determined by doing other tests to find out whether the problem is that you've run out of eggs or you're menopausal, which means we check a blood test called an FSH level, which becomes very high, and your AMH level becomes very low. But typically, the problem is what is called polycystic ovarian disease or PCOD, which is a word you mostly heard of because lots of people are now realizing that this is a surprisingly common diagnosis which we've been missing all along. When you have polycystic ovarian disease, because the ovaries don't ovulate, there is an imbalance of the hormone. What hormones are imbalanced? Typically the FSH levels are normal, but the LH levels are high. As a result of which, even though the ovaries contain eggs, they do not mature, as a result of which you don't ovulate, which means you have high levels of follicular phase estrogen. But because you don't ovulate, there is not enough progesterone production, so you don't get a period on time. And sometimes when you do get a period, which sometimes comes after 1.5 months or 2 months or 2.5, it's very heavy. And the reason it's so heavy is because there's a lot of endometrium lining which needs to be shed. How do we manage this problem? The good news is it's a very manageable problem. The problem is that you need to learn how to do this, and you need to remember is that whenever we give you treatment, it will only help you to induce a period for that particular cycle, not for the next cycle or the next cycle, which means every time you want to induce a period, if you have polycystic ovarian disease, you will need to take the medication every month. We're not curing the underlying problem, we're only inducing a period by treating you. And that's actually pretty much common sense, because what happens is in patients with PCOD, estrogen levels are high, but no progesterone is being produced because they're not ovulating, so the corpus luteum doesn't function properly. Which is why all we need to do is to give you a tablet which contains progesterone. Lots of different brand names available. Please don't use any hormonal tablet which contains 19 nor testosterone derivatives. Only use something which contains medroxyprogesterone acetate. Brand names are Meprate and Devitin. You can easily read this for yourself. It's not rocket science. The beauty about taking the Meprate is it's simple. You don't need a doctor's prescription every time. You only have to take 2 tablets daily for 5 days. That's a total of 10 tablets. And after you finish the last tablet, you'll get a period within anywhere from 4 to 10 days. The good thing about it is that even if you inadvertently take it in case you're pregnant, because one of the reasons for a missed period is sometimes a pregnancy, and patients with PCO can get pregnant on their own, the Meprate does not harm the baby, because it's a natural progesterone hormone. So the short basis is if you have irregular periods, you should understand what the reason is. The medical term for that is anovulation. The commonest problem is polycystic ovarian disease, though there are other reasons such as thyroid problems or prolactin problems, but I'm not going into those details right now. And once you learn to manage your cycle, you will have a lot more confidence in being able to regulate it, so you don't need to go running to a doctor every time. But please remember, the Meprate is very safe, it's a natural hormone, but it only works when you take it. So if you took it in January, you're going to have to take it again in Feb if you want to induce a period in Feb, and again in March if you want to induce a period in March, and that's fine. Because it's a safe hormone, it's extremely inexpensive and doesn't have any risks or downsides. If after taking the Meprate you still haven't got a period for 15 days after that, then you need to go to your doctor, and then they need to check whether you're pregnant or not, or whether there's some other reason for your missing your period. For example, you could have an ovarian cyst, which the doctor will then need to treat appropriately. Not very difficult, and once you understand the basics from first principles, you'll be able to understand what the doctor is prescribing and why. And if you want to find out more information about how to use Meprate and Deviri to induce periods in women with irregular periods such as polycystic ovarian disease, please go to our website. That's www.drmalpani.com. We've got hundreds and pages of information for infertile couples with irregular periods to help them to understand why their periods are irregular and what we can do in order to regularize the period. The information is all free, and if you have more questions, please send me an email through our website. I'm more than happy to answer them for you. And if thanks to this information therapy, you get a little less uncomfortable every time you miss your period, and as a result of this, it increases your chances of having a baby and getting pregnant, nothing will give me more joy and happiness, because the reason I became an IVF specialist is to help infertile couples to complete their family. See you online at www.drmalpani.com.